take 4. The one thing that nearly everybody in America is in agreement on is that we are suffering from a mental health crisis in our country. It's often referred to as our silent pandemic, and it's both collectively and individually. It used to be that the stresses of everyday life were something that most people could manage on an everyday basis. But now we have so many more people being affected in ways that we never thought we would see. School violence, social media being added to teens' lives. And many people today are struggling just to make ends meet, to put food on the table due to our struggling economy. Of course, the news outlets are always saying that the sky is falling, and it gets harder and harder for people to ignore when it's blasted everywhere you go. Most of us are employees, and we find that employers are understaffed and employees are more and more overworked each day. And this anxiety and depression are at an all-time high, and it doesn't seem that there's an end in sight. More and more people are struggling with their jobs and struggling because they bring that anxiety home with them. And it's not your fault. We just are not given the tools in order to combat this. It's something that for many people, it's the first time they've ever seen these struggles. Without treatment, you may feel like your job is the problem. And many times that may be the fact. But when you're the breadwinner and people are relying on you, it just adds an added layer of anxiety onto you. We've all heard the adage of put your own oxygen mask on first. But when you don't seek treatment, your productivity goes down, your absenteeism goes up, and perhaps that affects your paycheck. And you're putting your job at risk. And you also are going to experience increased medical costs when you're not addressing your anxiety and your depression. But many times the job is not exactly the problem. It's who you're taking to work with you, meaning yourself, that is the problem. So if you go and you try to find another job, you're taking yourself with you. And I'm not saying don't look for another job and don't try to better your situation, but with treatment, you could possibly try to stay put where you are for a while and only move one thing at a time, change one part at a time, because 80% of individuals that have worked with proper care, including therapy and skill building, find that their levels of effectiveness at work have increased, but also their satisfaction. And that's something that you take home with you. You take home the aggravations, but you could also take home the feeling of having a good day. So what we find is that people look to their employers because they're used to going to their employer for their health insurance, but the problem is that the help really isn't there. And when they do seek help, then they oftentimes feel a stigma. They don't want people knowing their business. And their employee assistance programs, while they mean well, are very limited in scope. They're very limited in length. And so next thing you know, you've gone through that stigma of perceived lack of confidentiality, and you've gone through the EAP, it's been very limited, you still need help, and now you're back into the health insurance, if it has any benefits at all for mental health, and you're facing deductibles and copays. But furthermore, especially depending on where you live, you're still going to have wait times. There are places in the country that have wait times in excess of 60 days, some pushing 90 days and beyond. And even if you do finally get in after 3 months, maybe you only have a couple choices, and maybe those choices just aren't ones that are good for you. In fact, 75 to 76% of employees feel that their employers should be doing more. And while this is also a program that can be offered to employers, what we're saying is don't wait, get the help that you need, because we all know that the pandemic has affected our mental health negatively. It's not only affected our mental health, but it's also affected our physical health, because mental health is physical health. And so sleep deprivation, trouble sleeping, getting sick very often, maybe missing work because of that, but not being happy. And when you're not happy and you're under stress, next thing you know, you're getting in fights with your children, fights with your husband, and other family members, isolating yourself from friends, and none of it is good. But some stress is productive. We're not trying to get rid of all stress. Anybody that has ever been working on a project and you have a deadline and you are just hitting it, or planning for a scrimmage, or the state champion in the football game. Anybody that has been in that moment knows that there is such a thing such as optimal performance. But many people know also you have 5 exams and you're in college and you're so stressed and you're not sleeping, and the anxiety gets to a point where you have a complete meltdown. So we need that fine line. But why is your insurance not necessarily the best choice? Well, for starters, it may not even offer mental health. Health sharing, mental cost shares don't offer mental health. And when insurance does, it often comes with a deductible and a copay, which may make that unaffordable as well. Does it have adequate coverage? How long does it extend? I'm going to show you in a few slides that we need about 13 sessions before we start to see improvements. Well, what if you're just about seeing improvement and then your coverage ends? Um, is the person that's creating this strife in your life, because often it's not you, it may be a child or someone in your household that is at risk, somebody in your household that's really needing the help. What if the insurance isn't there for them? And more these days, we see husbands and wives having split coverage, and you may have a household member that is not a family member. With our plan, it doesn't matter. And I will keep telling you over and over that wait times and provider options are a huge factor for many people in not being able to seek help. EAPs, employee assistance programs, they offer very limited help. And maybe that's where you start. But once again, now you're opening the door to a lack of confidentiality at the workplace. Are there any other options than insurance? Well, of course there are, because we wouldn't be here today talking about Rx for mental health. But let's take a look. Because could you imagine a mental health solution that isn't part of your insurance? Nobody needs to know that you're using it, you're at work, and it's affordable. You're not going to be nickeled and dimed every single time you want to use the program. And it includes the whole household, especially teens, because not all mental health programs include teenagers, but ours does. It's anonymous. Nobody knows, and especially your employer, but maybe you don't want your spouse to know. Maybe you don't want your children to know. Well, with our program, you can hide away. You can go out to your car. You can hide in the bathroom. You can hide in the closet, or you can sit on your couch. You can close the door of your office. Any of those can work for our program because nobody needs to know that you're using it. And we have a multitude of nationwide providers, and they're just not providers. They are excellent providers that Teladoc has hand chosen, that have years of work underneath their belts of helping people. We have that high quality standard, and it's easy to use. And why is it so easy to use? Because everybody these days has access to their cell phones, and I'll get to that in a moment. But virtual mental health solutions from Teladoc is something that has been perfected. It makes it easy for you to set up your account. It makes it easy for you to view the providers that are available. Choose one that you're comfortable with. Maybe change if you don't like them. Get on their schedule and actually have your session directly from your phone or your computer if that's what you prefer. There are several players that are involved here in making this work. First of all is Teladoc. Once again, they are the Kleenex of the tissue industry. They're the oldest telemedicine by far, and they are the gold standard. They've got 56 million paid members in the United States. New Benefits is our third-party administrator. They have 25 million members. And Rx4Mental Health, we're a subsidiary of Restore Health, but we were formed in 2009. So we have years under our belts, and we've served tens of thousands of members. Why is this important? Because if you find Teladoc online, maybe Facebook, or you go to their website, what you're going to see is that it's expensive. It can be $99 for a mental health visit. That, in our eyes, is not affordable, but we're different. We have an affordable price. We have accessibility nationwide with over 25 million members. And why are we able to tell you this? There's no contract required, and we have a price that is affordable. It's because of that sheer volume of people that we have, that we serve. $39.95 for a month, and that includes an entire household with no contract. In fact, you can try it for 1 month, and if you're not happy, you can get your money back. Savings on the cost of mental health are tremendous. And so I want to spell this out for you, because I mentioned earlier that 12.7 sessions is on average where 57 to 67% of patients need that many sessions before they see improvement. But what would this cost you at $195 a session? It would cost you nearly $2,500. But with our program, based on $39.95 a month, for in this case, an average of 7 months, would be $280. But what is the savings if you choose our program over traditional mental health care? It's a resounding $2,200. And that doesn't include the time that you had to take off from work. Maybe you don't have PTO, maybe you're paid hourly, but gas time, gas money, travel time. Perhaps you live somewhere where you're half an hour to 45 minutes from a provider. All of that adds up. Let me ask you, What could you do if you had $2,200 back in your pocket to spend on something else? I think it could make an impact. So let's take a look at the impact that you can have on your life and on your families. You could be happier at work. Once again, we're not saying don't change jobs, but the implication of doing that job change is actually a high stressor. It's virtual, so you can get help anywhere. Nobody needs to know. You choose your own provider. You can change your own provider. And in fact, anyone in your family, they can choose their own providers and they could change them as well. So you're not stuck. We have the privacy and confidentiality of using a non-employer program. Not everybody has a job where they can go in and say, hey, I need help. I'm suffering with mental stress. Perhaps a police officer gets put on light duty or on the desk and taken off their patrol car. There are many situations where people just cannot have that risk. And it's accessible. It's easy. Within 48 hours, you could have a licensed therapist, psychologist, or psychiatrist helping you. The telemedicine is even greater. It provides help without copays and without deductibles at no additional cost. And so these four benefits are $39.95, and they are included in your monthly benefit package for the entire household. As I'd mentioned, the mental health, we also have 24/7 counseling services. This is for acute situations. If they can't help you resolve your situation within 6 sessions, they're going to help you integrate into the longer term Teladoc mental health program, find a provider, and get scheduled. But we also have telemedicine. This is where you know the drill. If you've ever had children, it's 5:05 on a Friday night, and that's when your son or daughter comes down with a blistering fever and a sore throat, and your physician's office just closed. And now you're faced with going to an urgent care or possibly even the emergency room. And now you're presented with sick people everywhere, plus the costs. They can help you, they can help prescribe, they can help diagnose, but they could tell you if you need to go to that emergency room or you need to go to that urgent care. But anymore, within half an hour, you could be picking up a prescription and being on the way to health. This last one, Health Advocate Solutions, I cannot underemphasize the help in this one because the vast majority of people that have faced a home foreclosure, the cause of that has been because of unpaid medical bills. Helping to untangle bills, untangle claims, and negotiate lower medical bills is just phenomenal. But they can also help you with finding second opinions, locating providers, and maybe getting help for people that are in your household or aren't in your household. Maybe you're taking care of your parents and you just need help with all of that. All of this is something that we could add to the program. So I think I have a message here, and I think that you're going to agree. The message is take care of yourself. Don't look to your employer if they don't have a program specifically for mental health. Make sure that you have the confidentiality that you need and put your own oxygen mask on first, but get help for everybody in your family. Have the confidentiality you need at a cost that you need and the flexibility that you need. And I think that you're going to agree. We have packed a ton of value into RX for mental health. And so I want to thank you for being here today. We're always here for you. So if you need more information and it's time to go ahead and dip your toe in and enroll today, then click on the link below. Thank you so much.